Welcome to a webinar offered by the NBRC about item writing. My name is Robert Shaw, and I'll be facilitating the content here today. The NBRC has offered item writing workshops at the last several of the AARC summer forums and has received positive feedback from those sessions, and so the trustees thought that it might be useful to some who are unable to travel to summer forum to also be able to access this content. My intent here is to direct this more toward the writing of items for what we call teacher-made tests as opposed to standardized credentialing examinations. And so hopefully I'll be able to succeed in making this useful to those who are particularly constructing tests back home. I have 4 objectives that I intend to cover that are listed here. We're going to start by kind of jumping in the middle, or even the bottom, you could say, and talk about the guessing strategies that test takers may use while taking multiple choice examinations. I have some general guidelines about constructing items. Writing for multiple choice items is a particular kind of writing. It's technical in nature. It's fairly restricted on the one hand, and yet there are opportunities for creativity as well, which makes it unique. And we'll hope to touch on those. We'll talk about the features of desirable item construction, the way we like to see test takers interact with items, and then lastly finish up by talking about levels of cognition, constructing items to tap into certain levels of cognition, and then we'll wrap up. In all, I expect that the webinar should take perhaps an hour and 20 minutes or so in order to get to the end, and you should be able to pause and come back later if you need to. So starting with guessing strategies, we're going to fill you into the middle here. We have just the options of a multiple choice item, and so I'm asking you to make a guess here. And in this case, I'm asking whether you'd have some comfort eliminating one of the 4 options before making a guess or guessing among the other 3. And after studying this for a little bit, you might begin to notice a couple things. 3 of these fractions are divisible by 2, where 1 is not, and so the one that is not begins to stand out. Something else that you might notice is that some of the numbers are repeated. We have the numeral 3 and the numeral 8 that are repeated among some of the options, and on top of that we have both of those numbers all come together or converge at option A. And so actually a sophisticated guesser may wind up at A after first eliminating D, simply because of the somewhat careless way in which these options were presented. And this is something that we see a lot with items that come in, and so we're encouraging a little more care about the content of options so that we don't make it easy for candidates to guess at a right answer. So a solution is shown on this slide in which we now have 8 different numbers. None of them are repeated in any of the options. 2 of the fractions are divisible by 2 and 2 are not. And so if indeed 3/8 was supposed to be the correct answer to the item, when mixed in with the set of options on the right, it's not as easy to guess at that, and so that really here is the intent. Let's move to the next set of options for you to consider, and this time I'm changing the question a little bit. Now I'm asking, to what option would you narrow your guess? And again, in keeping with that theme about are some of these elements found in more than one of the options, that's going to be the guessing strategy here. And as you begin to study these option sets, you'll perhaps begin to appreciate that the name Sue shows up a couple times, the name Margie shows up 3 times, and those, again, actually come together there in option B. They do what we call converge, or we have a convergence flaw within this set of options. And so a solution is shown on the right. In this case, we are permitting the reuse of elements, but controlling the way the elements are reused by only using each of them twice, evenly distributing them among the options. And if there were any test takers who might make a guess based on the order, then we've placed the name in one case at the beginning, and then in the second, with the second use of the same element, placed it at the end. And so it's again this more sophisticated way of looking at options that I'm trying to encourage in part with this webinar. On this set of options, we're back to the question about what would you be comfortable eliminating before guessing among the other three. And here we have an order of magnitude flaw or problem in which option A stands out as being different from, appearing different than the others. We can fix that in a couple of ways. One is we could give another option that was similar to the 2500 that we saw before, and we'd effectively wind up with two pairs of options for candidates to consider. Or in the bottom set, you can see that we have four values, all of which fall within the 20,000 zone, and therefore they all appear similar to one another. Here we have an example of some options that are in the respiratory care content domain. And what we perhaps begin to appreciate first is that option D, dog, stands out because it's not a setting on a mechanical ventilator. It's something that's done as part of bedside diagnostics or assessment. So D begins to stand out, and so a candidate who's going to use a guessing strategy would pretty quickly eliminate that from consideration and guess among the other three. And then on top of that, while considering the other three, the guessing test taker may notice that two of these things have start with the word increase, where only one starts with the word decrease. And so here in sort of a second round or second filter, that candidate may eliminate D from a guess and then narrow it down to either A or C, the two things that are being increased. If indeed the key resides in either the A or C position, now a test taker using guessing strategies can have a 50% chance, a coin flip's chance of success, and which is much greater, twice as much as where we'd like it to be, which is down at 25%. So you see one solution has been offered over here on the right, which is we've replaced D with yet another thing that one can manipulate on a mechanical ventilator. We've also balanced up now whether we're starting the option with the word increase or decrease, since we have two of each. There's another solution in which the writer could say, well, let's make all of these about things that are increased, settings that would be increased on the ventilator, in which case we move the word increase up into the stem, as we see on the right-hand side, and now all we have are the things that could be increased listed in A, B, C, and D. This tightens things up in terms of writing. It actually makes it easier for a competent test taker to find the right answer, and it's, again, a more sophisticated approach to item writing that I would encourage. Moving forward now to some general instructions about item writing. And first, let's focus on what it is we're trying to accomplish with one item for a standardized test, what it should and should not do. What it should do is measure one ability at a time, or one thing at a time. And abilities are things like competence as respiratory therapist, but then there are other abilities like the ability to comprehend written words, the ability to perform mathematical calculations are some other abilities. And so it's possible for these other abilities to begin to entangle with testing, so that instead of purely measuring competence in the respiratory care domain, we kind of migrate over and we start putting too heavy a reading load on people or too heavy a mathematics calculation kind of load on people, and so the scores get skewed a bit because of entanglement with these other issues. And so the point here is we want to do what we can, give some conscious thought to the fact that this can happen, and do our best to avoid entangling other abilities when we construct a test item. A test item on a standardized test like the NBRC examination is going to contain some sort of stimulus or even stimuli, multiple things that we are going to ask somebody to react to give a response about. The stimulus could take the form of a question, which is pretty straightforward, but could also be an incomplete sentence, and we will ask the individual to tell us which of the options best completes the sentence. There's also a pretty strong prescription for what would be an acceptable response. Tests today are administered on computer, and so one must use the tools available from a computer interface in order to submit responses. Back a decade or more ago, when tests were administered in paper booklets, there was a different format for submitting acceptable responses. Now, it may surprise you to hear me say that whether or not one correctly answers one item on a test, that's an NBRC test or a test made back home for a classroom setting, is not a big deal, even for an NBRC test. There should be no deal breaker items on an exam where, well, if you get this item right, well, you automatically fail. That just doesn't happen. Not in a standardized testing environment, neither should it really happen in a teaching or classroom environment. The powerful inferences that we want to make from test scores are the result of summing together a sufficient number of responses from a whole test. And so it's that on which we rely. In order to answer questions like, well, has a sufficient level of learning occurred for this individual, or is someone officially competent in order to safely go out and be trusted to handle patient care. Let me mention a couple points about item formats. There are a couple of basic types, although this is not a complete list. There's what we call a constructed response type of item format, in which the test taker is expected to, as it indicates, construct each of the responses. That could be a single word, it could be a sentence, it could be a paragraph, it could be 2 pages worth of writing. A multiple choice examination is one in which the responses have been constructed for the test taker, and then they're asked to select among the responses that they've been offered. I'll suggest to you that, again, thinking about the teaching setting, teaching learning environment, classroom setting, that constructed response items can be useful, particularly for measuring learning as it is forming. Sort of learning along the way. We learn this piece of information, and then we're going to have another instructional section that builds on what we learned before, and so forth. And so constructed response can be useful for assessing that formative learning. Multiple choice is well suited for measuring learning endpoints. So the final exam for a course, or the midterm exam for a course, or certainly an NBRC credentialing examination would be considered assessment of endpoints. And so we use multiple choice for that. Comparing those two types of item formats in this slide, what we see is that the total amount of time invested in either multiple choice or constructed response tends to be about the same. But the proportion of time that one spends in writing and scoring is really dramatically different. If you're going to do multiple choice item writing well, or item testing well, you're going to put most of your time in the writing. That can include writing an initial draft of each of the items. Can include revising each of the items that you've written. Can include submitting your items to some colleagues and asking them to react to them and see if they seem to be fair, if they're clearly worded, and then again to go through another round of revision. All those things can go into the writing element. The scoring element for multiple choice tends to take comparatively little time. Because of the heavy investment of time and care in writing up front, effectively multiple choice items can be automatically scored. And it is on that fact that the instant scoring in the NBRC system is now allowed ever since computer-based testing started. With constructed response, the items can be actually fairly quickly written. That's not to say that there shouldn't be some revision, that you wouldn't expose them to review by other peers if it's a higher stakes exam within the within your system, but still it typically does not take as much time to construct each item. The heavy investment in time comes in the scoring, that is, if you're going to do it right. There ought to be some careful thought and even the development of a systematic rubric for scoring responses to help describe, before you look at their responses, what is it that I think deserves full credit. And if not full credit, then what should justify partial credit, but a high level of partial credit? What should justify a middle point score? What should justify something less than that? And what should justify someone writing but getting no points? And so all that goes into more scoring time. And one other thing I'll say about if scoring constructed response items, again, if there's some reasonably high stakes associated with the outcome, is there ought to be a second reader. There ought to be a second person evaluating it. If the two readers disagree about the points that ought to be awarded, then there ought to be another or an opportunity for them to come together, interact about what one saw that the other did not see, and so forth, and then resolve their differences. Some of the reasons that NBRC uses multiple choice items for all the examinations except for the simulation, which is sort of a special case of multiple choice, is first off, we perceive that these items tend to be objective, particularly in the scoring. Either you get the item right or you get it wrong, and that translates into a 0-1 scoring system in which there's no opportunity for partial credit, where subjectivity could creep in and influence the degree to which one gets a 3 out of 5 as opposed to a 4 out of 5 on a particular item. We find that in spite of what may appear initially to be a pretty limited kind of writing that or context for writing, that it's actually a fairly flexible technique. That we're not just limited to text is really the point here in the middle of this slide, that we could have drawings, we could have photographs, one could even have video clips associated with the stimuli that are presented to test takers and for which we expect a response. It is particularly efficient. There are, depending on the examination, thousands of candidates who will take an NBRC examination, and individuals can read text faster than they can write. That's a simple fact. And so we can get more items in front of someone, collect a larger number of responses, more points, or more data points can be collected, and therefore the accuracy of the information we collect about someone's ability is enhanced, particularly because of the efficiency associated with multiple choice testing. This too is reinforced on this next slide about precision, getting more responses within a given amount of testing time. And then lastly, multiple choice items are immune to any halo effects. It's not too much of a stretch to expect that even though a teacher may make a point of blinding him or herself to an individual's test, or who it is whose test it is that they're grading or scoring, that they eventually begin to know who it is just from their handwriting, know who the student is from the handwriting. And so if an individual is scoring someone's test and they happen to know that person has historically been at the top of the class, then that halo effect can carry over into the scoring of a particular test, even though the individual may not have done the best work on that particular test. And so the multiple choice exams don't care how well test takers have done in the past. All that matters is what they're doing right here, right now, and that too is why we use multiple choice items for NBRC examinations. In order to talk about item writing, I'll need to sort of break down an item into its pieces, into its anatomy here. And so I have a slide where I'm just going to define some terms so you'll better know what I'm talking about when I refer to it later. So here we have an item on screen. Don't even bother really reading it. We have this bit at the top where the story starts and ends, and we call that text the stem of the item. We then have for what we call options down below. These are the responses that the test taker can select. Within the stem, we have this little bit here that lies between the beginning of the story and the response options, and we call that little bit the stem to options connector. Within the options, we have 3 responses that, if selected, will get the individual who selected that no points. We call those distractors. The name is purposely chosen. Distractors should be written in such a way that someone who hasn't mastered this concept will be distracted away from the correct answer, or the key, which is the last of the options that we'll talk about. And we'll also talk more about what justifies a key as compared to other distractors and so forth as we move forward. There are 2 basic stem formats that we can use, particularly when we talk about that stem to options connector. We can present to the test taker a direct question, and here's an example of one of those. So we have the initial capitalization, we have the appropriate question mark, ending punctuation here to signal to the reader that here's a complete thought, it's a question, and we're going to ask you to respond to it. We could stimulate a very similar set of responses with an incomplete statement, and then presumably after reading through this incomplete statement, then the reader would know, I need to read down into the 4 options and find the one that best completes this sentence. Either of those are viable, and it's really up to the writer to choose which one works best in each case. Among the options is going to be our key, the correct answer. The answer is going to, if selected, earn that test taker 1 point. And you only need, as a writer, to justify your key as compared to the other 3 options that you happen to offer. This is an area where test takers get confused sometimes because they want, after reading the stem, they want to compare the 4 options to all the other possibilities that are in the universe. You may have heard or discussed with others the fact that a test taker overthought their responses to a particular test item or items, and that's what they're doing when they overthink items. Is they're ignoring the 4 options in front of them, and they're bringing in other thinking about other possibilities that haven't even been offered to them. And so, candidates or test takers ought to be discouraged from doing that, and instead should be focused on just those 4 things that have been offered to them. Distractors need to be justified because they are worse in one way or another than the key, or at least if the key is better than one of them. Another element of this is that a distractor doesn't have to be absolutely incorrect. And that can be a handy strategy for coming up with a challenging item. And as we'll talk about a little bit, we do want challenging items, both for NBRC examinations and for a teacher-made test. You should want items that will challenge your test takers. And I'll explain more about why that is. Things to do when writing stems. We strongly encourage you to use positive wording. What this means is that you direct a test taker to find the best answer, or to find the thing that should be done next given the scenario that you've just laid out. And then those are classic ways of using positive wording. The alternative, we call them negatively worded items, are occasions when a test taker would be instructed that there are multiple correct things in the list below, and it is instead your task to find the thing that's not correct. And when you do that, then that begins to pull in some other abilities, as we talked about and I warned about before. And so there is some research in this area that indicates that it's best to present positively worded items. Now, having said that, you will find still some items that have negative wording in NBRC item banks. Those have been tried out multiple times. The item statistics still indicate that candidates can find the correct answer, the higher ability candidates can find the correct answer among those items, but I'd expect those to begin to phase out as time moves forward. So again, the point here is I encourage you to use positive wording in your items. You may ask, well, why do negatively worded items exist? And the simple answer is because they're easy to construct. They're easy to write. It's easier to come up with 3 correct and 1 incorrect answers than the alternative. 1 best answer and then creatively justify 3 incorrect. Coming up with distractors is the single hardest part about constructing multiple choice items. And so, you know, if time is short, resources are short, sometimes writers take shortcuts, and using an item technique in which you ask somebody to find the thing that doesn't belong is a way to come up with an item, but again, it typically represents a shortcut of one kind or another. We encourage that one write in a third-person style. And here are 3 examples where we refer to a nurse rather than Nurse June or Nurse Betty or Nurse Bob. Or we say a supervisor reports, the patient states, we don't give the patient a name. And oftentimes if gender isn't going to matter to what the right or wrong answer is, we won't even give the patient a gender. If you find that you're using pronouns in a multiple choice item, then you're not in the third person writing style yet. The one exception to this rule is for the simulation examinations, in which you will see language like "you are the respiratory therapist on the night shift" and so on. But for the multiple choice items, we try to keep things a bit more distance, a bit more objective, to help encourage test takers to understand that what we're asking them to do is to apply national standards of care rather than being queried about how they would behave in their local institution. I strongly encourage revision as a step in the writing process, because you typically will make things better when you revise. It's highly unlikely that you'll come up with a completely viable item or a well-crafted, well-constructed, clean item on the very first attempt. And so use the opportunity to rewrite, to remove text that will get in the way. So if there's extraneous information that you find up in the stem of the first draft of an item and that information does not impact any of the options, well, then it's better off to be removed. I do understand that there could be, or the point of a particular test item is whether the individual can sort out from a whole large bag of information the really important pieces of information that they need, but that's not always the case, and so more often than not, remove extraneous information. The point about vocabulary, I want to make sure I'm clear about. There are certain technical terms that a competent respiratory therapist must have mastered, and those are not the kinds of vocabulary terms I'm talking about here. I'm talking about everyday English that one chooses to use. And a multiple choice item for any test, whether it's an NBRC or teacher-made test, is not the place to try to show off your vocabulary. I also encourage in multiple choice items shorter sentences as compared to long sentences. Again, the whole point, particularly of a STEM, is to communicate to the reader. And by giving them small digestible chunks of stuff to read and comprehend, they're more likely to comprehend the whole story. Things to do in writing options. This slide is about what we call flow, and that is, does it make sense? Does the reading make sense as we flow from the stem down into the options? And we're really focused on 2 points here. does it make logical sense, and does it make grammatical sense? Because if there's a grammatical disconnect between any option and the stem, then that can be a tip-off to a guessing candidate that that option's not going to be the right answer. There's also, we oftentimes find a problem between the logic of options, or oftentimes it's one option, and the way the stem is presented. An example is shown here in which the premise is, what should the therapist do next? So that stem is setting up an expectation that indeed the therapist is going to do something. And so having an option that says nothing is incongruent with what the premise of the stem is. And so there's an illogical disconnect between those two, which makes it pretty easy to remove nothing from a guess. We could at least make the flow logical if we add a phrase. So we say, what, if anything, should the therapist do next? In which case, then having an option that says nothing at least makes logical sense. This could be viable. If you wanted this as an option for an item, then there probably ought to be another item on the same test in which nothing would be a correct answer. Otherwise, again, it's a pretty easy option to throw away. And still a better strategy that I encourage writers to use is to find another way to communicate that you're not going to really do anything at the moment. And so a phrase like continue to monitor the patient sounds positive, but it certainly is indicating that we're not going to do anything different than we've been doing up to this point. And so an option like this last A, continue to monitor the patient, is going to be perceived as more plausible and harder to discard among guesses. An example, a real-life example is shown here. We have set up a premise in which one of the things in the list is going to solidify a diagnosis. And so if we come across an option like D that says, I'm not sure, then again, we have a logical disconnect. And it's easy to do to discard D from a guess and then guess among the other three. So that's a problem and something we want to avoid. It's also an indicator that the writer kind of gave up. The writer, either because they just got worn out or pressed for time or got lazy, they decided that they were only going to come up with really two useful distractors and give up on the third. That also raises a point that I'll talk about a little bit more in a slide or two later, which is that having a multiple choice item with only 3 options total, so 1 correct or 1 key and 2 distractors, can be a viable choice. And we'll talk more about that in a little bit. And right here it is. If you think about a scenario in which you have, let's say, an hour of testing time. So instead of teaching for this hour, we're instead going to have testing for an hour. Or we've got a time scheduled at this point in the semester, and it'll be an evening, and we're going to have an hour's worth of testing there. And so the testing time is fixed at an hour. A teacher could conclude, well, I think it's reasonable for my students to respond to about an item every 2 minutes, and so I'm going to have 30 items on my test under the assumption that each of those items will have 4 options. And so in total, the test takers will be interacting with 120 options. Well, in order to have an equivalent sort of assessment, that is in terms of reading load and so on, and in terms of, again, using that 1 hour, if you decided, well, I'm only going to have 3 options in each item, well, in order to come up with the same number of options for people to consider, 120, that would encourage using 40 items instead of 30. Now, one could argue that adding 10 more items, even though they're 1 option fewer, may be too much. And so you could play with that. You could have 38 items instead of 30, or 36 items instead of 30. The real point is you're going to get that many more data points, and by so doing, you're going to get that much more accurate of a set of test scores from a test that contains more items. And so This is what I mean when I say having 3 option multiple choice items can be quite viable, particularly in a teacher testing sort of environment. When writing the stemmed option connector, there are a couple ways to go. If you know that your key is definitive, that is, you can point to a particular standard, or you know that it's the result of a calculation and there's really no other possibility in the universe for what the key is, then you can start that sentence with the word what. If you have a key and you're justifying it with the information up in the stem, but you ultimately arriving at the key relies on judgment, that there could be multiple correct answers out there in the universe. Then using a phrase like which of the following is a better way to go, because it hopefully helps clue in the reader, the test taker, that they should really focus on the following 3 things or 4 things, depending on the number of options you choose. And that can be a handy way to start out the stemmed option connector in the alternative case. So you could theoretically have a whole test full of items, and either you're starting with the word what or you're starting with the word which of the following. I'm not saying that you must do that, but if you have some struggle with getting that stemmed option connector started, this is a tool that you can use. I have a recommended sequence of writing. Probably pretty clearly you have to start a story at the beginning, so there's your stem, and then make a choice about which stemmed options connector you're going to use, using what or which of the following as we just described. But the real point of this slide is write the key before you write the distractors. And the reason for this is, as I'll indicate in the slides that follow, it's really important that the distractors look like the key. That means there's a similar number of words. So the length of each option is about the same. That there's a similar level of detail in all of the options. So again, they look similar. They look equally likely to a test taker who's going to guess. And so I sometimes struggle myself, because as I'm beginning to write an item, and I get down, I finish the stem, I've finished the stemmed options connector, and then suddenly a really good idea for a distractor will pop into my head before I've actually written the key, and I have to resist that, because I know that I'm going to want my distractors to look like my key. You know, sometimes you may have a segment of a sentence with a comma or the word "and" in there, and then you're going to tag on another fragment of a sentence. If that's the way the key appears, sort of in a sense, so it has 2 sections to it, well, then each of your distractors ought to have 2 sections in it as well. This is a basic guideline indicating that you ought to have more words in the stem of a multiple choice item than you find in the options. This gets violated actually with surprising frequency. You know, I'll receive an item in, and the stem will be pretty short. It'll say something like, which of the following is true? And then each of the options will go on and on for 2 and 3, 4 lines. And that really is inverted the kind of relationship we like to see. In that case, you want to take most of the text that appears in the key, move that up into the stem, and then come up with a fresh set of distractors that'll finish up that sentence. And by leaving shorter phrases distributed among the options, you're actually going to make it easier for a competent candidate to find the right answer. And that, too, you'll hear me say probably more than once here, that is important. That is just as important as it is to keep candidates from succeeding simply by guessing. On that theme of kind of moving text from the options up into the stem, sometimes you'll find after you write your first draft that you've used either the same word or even the same phrase to begin each of the options. So this is a simple fix. You take the repeated word, you take the repeated phrase, and you find a way to rewrite the stem and move that information up into the stem. And then again, what you're going to wind up with is shown at the bottom, where the options become shorter, they become tighter, cleaner, easier to read, easier to comprehend, easier to find the differences among the options. Here's another example, and I put this here because the redundant text is harder to find, because now instead of appearing at the beginning, it's kind of hidden or sprinkled throughout. I can make it a bit more obvious now, in which case you begin to see that, oh, really the only difference between these options is where the words decrease and increase appear. And so we can help the candidate in that regard by actually making a table out of the options, taking those repeated elements that we want to assess and then making column headings out of them and creating options that way. And this technique of using tables or making a table out of the options is a really handy way to measure multiple things at once. Particularly if you think about a scenario where a therapist should be moving on multiple fronts, like in an emergency situation, then you can put those multiple things up there as column headings and then populate the options with words like this, decrease, increase, or yes, no, in terms of those things that a therapist should or should not be doing at this point in time. And you're not limited to those things, but just a handy way to create a table out of options. The purpose of this slide is to really talk about your attitude and the differences in your attitude as you write stems as compared to writing the options. When you're writing the stem, you want to do so from an attitude of helpfulness. You want to sit there and you're saying, okay, test taker, I'm going to help you understand what this situation is. I want to help communicate to you what each of the detailed points that you need to arrive at the right answer is. But when you get down into particularly the distractors, then your attitude should shift from being helpful into a more ruthless attitude, where you're going to use the things that you know that they have misconceptions about and offer those up to them as incorrect answers. If a multiple choice item does or is asking someone to run a calculation, then you could anticipate the ways, or you could even use what you've observed about the ways in which people have mishandled the calculation and come up with those as wrong answers. Let's talk about options a bit. You want to write the distractors that you're confident that at least some test takers are going to select. We don't want, ideally, each one of the distractors would be selected by at least some people, and that includes teacher-made tests. If you administer a test item and find that nobody in a class selected one of your distractors, then that's a candidate for revision the next time that you need to administer that item on a test. That's specific information that's saying this isn't really doing anything. Now, I do understand that in most teaching situations, you're looking at a fairly small number of people, and that if you tried it again exactly written the way it was with a new class, by expanding the number of people reacting to the item, there's a chance that you might get somebody in that next class to bite on the wrong answer. So I'm not saying always you have to do this, but again, you should be sensitive to the fact that nobody is selecting the distractor as a signal that it probably ought to be revised or replaced. You want to use language in your distractors that candidates are going to find familiar. You want to take care to populate distractors, that's wrong answers, with fancy sounding technical terms, scientific terms, common word associations with which the test takers might relate. Again, I'll emphasize that when a test taker encounters your whole set of options, they should all look similar to one another. So if the key, and this again is why I want you to write the key first, if the key winds up being a whole sentence, then you need to make sure that each of the distractors are also sentences. If the key is just a couple, 3 words, then you should not have sentences or big, long distractors to associate with those. The real problem, of course, is that the key becomes longer and more detailed than the other distractors, which is a clear tip-off to test takers who are going to guess. And we neither want to push candidates away from or pull them towards the key. That's really the point of this slide. I sometimes have individuals who participate in the workshop, and once they hear me say that test takers will be attracted to the longer, more detailed answers, then they'll say, okay, well, I'll just outsmart the test takers and I'll make sure the key is the shortest. And so that too can be a problem, because you could have test takers who are somewhat competent, whose initial impression may be to go for the key, which happens to be shorter, but then they'll talk themselves out of the right answer once they look at or compare the links and the details of the option. So again, you want people to approach the options from the point of view of neutrality. They all appear to be similar, and that goes to the length, it goes to the detail, it also goes to balance among repeated elements, as we've pointed out very early in the workshop here. So here I have a flawed example, and we're going to spend a little time bouncing back and forth between this slide and the next, where I'm going to show you sort of the starting point where we had a flawed set of options, and then the steps that I took to address the flaws that I saw. In this case, the option E is the key. And it's pretty obvious to a guessing test taker that E is the key, because first off, it's longer. It also stands out because it's actually 2 steps. We're going to request the pathologist to recut and also do a special stain. So it's the only of these options that has 2 steps to it. Now, something else that is a flaw in this is the key is a sentence, starts with a verb, request the pathologist. We do see another sentence in this set of 5, which is option C. It starts with the verb discontinue. But then we have A, B, and D, which are not sentences. And that's in spite of the fact that the writer has presented them as sentences with initial capitalization and a period at the end. So, you know, just putting in the sort of window dressing of a sentence doesn't make A, B, or D really sentences. And so again, if we're going to wind up with a sentence of the key, then each of the distractors also need to be sentences. So what I did first, let's focus on E and jump to the fix. In order to simplify that option, option E, make it shorter, and also to make it look like it was all sort of one step, this is what I came up with. So instead of request the pathologist to recut, recut's kind of a term of art that draws attention as well. Recut the lung tissue and do a special stain. We instead say, ask to have the lung tissue cut again with a special stain. So this is using simpler language, and so this actually makes it less attractive to a candidate who's going to guess, and yet it still gets the same point across. We go back to option A. We had right upper lobectomy via thoracotomy. That's not a sentence, and it needs to become one. It also needs to become a bit longer, so it matches the length of option E. And this is what I did, perform a right upper lobectomy by thoracotomy. And so that is the alternative that hopefully would look more similar to E and be more attractive to test takers. We have B, percutaneous liver biopsy. Again, not a sentence and also pretty short. So here we had to kind of throw some words in to stretch it out. Take a liver biopsy using a percutaneous procedure. Then we have C, discontinue amiodarone. That is a sentence, but it's awfully short. So what I went to here is prepare to discontinue the amiodarone drug therapy. So finding words that I can throw in order simply to lengthen it. Referral to hematology, oncology is the last of our distractors. Again, not a sentence, and so take that word referral and make it a verb. Refer this patient to hematology, oncology, or to the hematology oncology service. So again, looking at this set of 5 options, they all appear to be similar in length, detail, and we're certainly not as likely to see someone who's incompetent in the area wind up right at E as their guess. And so it's that, I use this as an illustration here of, again, that kind of more sophisticated thinking that I hope this webinar encourages you to take as you address and construct options. Let's talk about difficulty that in regard to finding the key of a multiple choice item. And here's where I'm reinforcing the fact that coming up with good distractors is the hardest part of this whole process. But what we're really looking for are items that are moderate in their difficulty. So in other words, not too difficult and not too easy. So we're kind of looking for the Goldilocks solution here. We have this graphic to help illustrate this. What I'm showing along the x-axis is our numbers to indicate how difficult an item might be. Over on the right-hand side, these are the proportions of people who correctly answer. And so over to the right-hand side are items in which most people correctly answer. So 70, 80, 90, 100% of test takers correctly answer those items. Down on the left-hand side are the really difficult items in which very few of the test takers, or low proportions of test takers, correctly answer. Now, in this graphic, I'm relating this factor, the item difficulty, or the proportion who correctly answer, to, as you'll see, contribution to reliability. And what this graphic is showing us is right at the midpoint. So right at the point where half the candidates correctly answer, half miss an item, that maximizes the contribution of one item to the reliability of scores. Now, does that mean that we should load up our test with items in which half the test takers miss? No, not necessarily. We get just as much or nearly as much mileage from an item that's correctly answered by 60 or even 70% of test takers. We also get mileage out of items correctly answered by 40 or even 30% of test takers. You know, an individual item that is in the 30 to 40 zone is quite viable. We certainly wouldn't want to load up a test with items that were that difficult. That would be a pretty frustrating experience for test takers if they're only getting like 3 or 4 out of every 10 correct. But what this graphic is also saying is that items at the extremes, either extreme ease or extreme difficulty, are less useful to testing. And kind of continuing that theme, what I'm showing you here is that you as a writer make conscious choices and can actually titrate how difficult your set of options may be. In particular, this is showing an example in which the number 89 is the key. And that's all that we're offering in the options are these numbers. And so if you fairly closely approximate the other numbers, then it'll be more difficult for the typical test taker to find the key among that set of options. We could widen things out a bit and make it a little easier, or we could even go even further out and make it still easier. And really the point is that you as a writer should strive to optimize the difficulty, not necessarily maximize the difficulty. And that takes some judgment on your part about what it is that the test takers are bringing into the testing experience, and what is, how difficult is it likely to be for them to find the answer, either from numbers that are closely associated with one another or more widely dispersed. I'm going to talk here about the concept of balancing elements, and this is when we find it necessary to or happen to repeat an element. In this case, the column that's labeled pulling attention shows a set of 4 options in which the concept of error rate has been duplicated in a second of the options, A and B. And not only that, but in the case of A, we're saying high error rate. In the case of B, we're saying low error rate, so they're going in opposite directions. Option C heads off in a different direction with volume, and then D in yet another direction with efficiency. So a test taker who's going to guess and sees this set of options is going to have their attention pulled toward A and B. And again, if either A or B is the key, now we're at a 50-50 chance of a correct guess, and that's a source of measurement error. And so one thing we can do is shown over on the right-hand side, in which we are now going to offer to them just 4 discrete choices. We're not going to repeat any of the elements among the options. It's also possible in this next slide, you'll see we've even made the pulling attention problem worse, because now we have 3 options that are about error rate, and then we have D, which goes off in left field and talks about efficiency. But again, another solution is we can pair the options up. We can make a purposeful choice to repeat the use of the element, but then give it a counterbalancing pair, so that when you look at the whole set of 4, each of these now seems equally likely. Have a set of things that we want you to avoid first when writing stems. You want to kind of be on the hunt for irrelevant sources of difficulty. So big, long words, fancy vocabulary, long sentences, complex sentences. Those should all be rooted out and revised. And again, you want to keep your calculation steps to a minimum. If you have, for example, a 3-step calculation, you could have 3 people miss at each of those 3 steps, but they all get it wrong, but for different reasons, and now you have a bit of a validity problem. So if you can focus someone in on a particular step of a calculation with your item, then that's a better solution. Sometimes writers, when they make the choice to use an incomplete sentence in the stem, they won't give the test taker enough in the stem. And we wind up with what we call an undirected stem. And I'm showing you 3 examples down below. If all you were given was the first priority, or infection risk, or a critical check, and nothing else appeared in the stem, you don't really have a strong enough sense of direction about where you should go that should lead you in a particular way. And you really wouldn't be able to figure things out until you carefully read each of the options. Now, you might argue that's a fair point of testing, but it really is asking too much. And so you ought to give people more direction coming out of a stem so that a competent candidate, after reading a stem, has a pretty clear idea of the key they ought to be looking for. And they ought to be surprised if they don't find it. And so again, be on the watch for undirected stems when using that sentence completion item format. For options, you should not permit any data ranges to overlap. So the example at the top is showing you how to do it wrong, and the example at the bottom is showing you how to do it right. So the problem is that the value of 34 in the upper example appears twice, 36 appears twice, 38 appears twice, so potentially the correct answer could appear in 2 positions. Another point to avoid is mixing units of measure among the options. Here we have units of measure based on time, and I've given you kind of an extreme example in which I've made the choice in the wrong example to use 4 different units of measure. And so it's more difficult to find the right answer in that set than it would be in the set below, in which we've standardized on a single unit of measure. You're going to be careful about mixing families of ideas. Now, on the left-hand example, we have 3 kinds of fruit and then a tool. And so the one thing, the hammer, stands out because it's in a different family of ideas. We have an example on the right in which we have 3 organizational departments or divisions, and then D is a specific person. So if your key is a division or department, then make sure that each of your distractors are likewise departments and divisions. If your key is a person, then make sure that each of the distractors also describe other potential people that the therapist might encounter. Here's an example that illustrates the flaw. If we study this for a minute, you may begin to appreciate that the middle 3 options here actually list the names of specific drugs, where the A and the E options are categories or classes of drugs. It's not that you shouldn't list specific drugs. That can be a perfectly fine technique to use in multiple choice testing. It's just that if you're going to have a drug name as the key, then make sure you have drug names, specific drug names in all of your distractors, and don't mix drug names with drug classes. I'll also offer the side comment that in order to encourage longevity of an item over time, if you have a choice or feel like you have a choice, or it's a toss-up between using a specific name or a drug class, I'd go with the drug class. That's because specific drugs come and go on and off the market, and so by listing a drug class that you're confident will continue to be available over time, over decades, then that item is likely to be able to live longer without having to be adjusted downstream. Be careful about combining subsets of of a system altogether. So in this example, the cardiovascular system is made up of peripheral, capillary, jugular veins, and the pulmonary artery. So those are all subsets. A, B, and C are all subsets of the option D. And so it's not fair to offer both the elements of the system and the system itself within the same set of options. You want to be watchful about tipping off by repeating use of the exact same word, both in the stem and then in the key. That's not to say you could never do that. You could do it. You could repeat the use of that same word as long as that word appeared in all the options. But it's when a test taker can look at a stem, see a word, an important word, and then find that same word, and it only shows up in the key, that could be a tip-off and a clue and help somebody guess at the right answer. Same way with technical and more detailed language. If that only appears in the key, that too could be used as a guessing strategy. Tipping off in regard to qualifiers, you need to be mindful that any statement that includes a less precise, or what I'll call a soft qualifier, like may, sometimes, usually, that any statement with those softer qualifiers is logically more likely to be true, and therefore more likely to be the key. And that's as a counterpoint, if you're using a qualifier that's more precise, or a harder qualifier, like never, none, or more absolute, never, none, all, only, always, then any statement that includes that word or any of those words is logically less likely true. And so if those kinds of words only appear in distractors, then it makes it easier for a test taker to guess that that statement is incorrect. Lastly, here I'm addressing options that would be all of the above or none of the above. I'm pretty sure you've probably taken tests in the past that included these. Very often, all of the above is going to be correct, and it's very unlikely that none of the above is ever correct. That's one reason we don't use them, and why I discourage you from using either of these in your own test. There's also validity problems here. In the case of all the above, a test taker could come across option A and recognize it as correct. Option B, recognize that it is correct, but be uncertain about C. But then as soon as they continue to read and see that D is all the above, then they know that D has to be correct, even though they're uncertain about C. And so they're, in a sense, they're getting credit for knowing the three things above, even though they didn't really know the three things above, and that's the validity problem. As far as the none of the above option, you're actually encouraging people to do what I spoke about before, which is to think about other options out there in the universe that haven't been listed with the multiple choice item. Because you're saying, look at these things, and you potentially could select none of the above, and that's because you're thinking of something else that's not listed and choosing it instead. And the validity problem there is you could have one person select it for one reason, that is they're thinking about one other thing, and somebody else select none of the above for a different reason because they're thinking about some other option that again wasn't listed. So again, it's that element of things that aren't listed that you're asking somebody to react to that is particularly problematic about none of the above. So I'd encourage you to avoid both of those in teacher-made tests. We receive items at the NBRC that include those. That's a pretty quick send back to the author because we'll pretty much just reject those straight away. Going to transition here into talking about Cog Levels. This is the final section of the webinar, and I want to preface what I'm going to say here by first saying that cognitive levels is the area in which I observe that item writers fail most often, or fail to meet our expectations. I should say first that the reason that we have levels of cognition specified for examination or examinations is that the competencies that we expect of a respiratory therapist vary in their complexity. There are certain things that a therapist needs to have memorized and therefore recall. There are other things that they need to be able to apply in order to make predictions or understand that this thing is related to this other thing. And then there are other situations in which we expect the therapist to problem solve, use judgment, to analyze a scenario, a situation, and then find the best solution. And because of that, that's what's inherent to the job, and we're trying to mirror with our test what happens on the job. That's why we have levels of cognition, again, specified for the items. So each item has a specific role to fill. It's supposed to tap into a particular area of content, but while also doing, it's also supposed to be written at a particular level of cognitive complexity. And so every item that we assign to a writer will have those two elements at least identified for them. And again, the area in which they fall down most often is they'll miss on the cognitive level. In particular, we'll be asking for an item at one of those high levels of particularly the analysis level of complexity, and what we'll get back is either a recall item or at the application level. They'll have failed to reach that extreme level of complexity, that high level of complexity that we're trying to use for the test. Going to talk about recall items first. Typically, these are going to ask candidates to draw from facts that they've already memorized. And if you're the teacher, then you know what you've taught, and so you can have some confidence about what it is that you'd expect a participant in the classroom to have memorized already. And we have to be a bit more general with the NBRC in terms of, okay, if somebody has passed through a typical accredited curriculum, then what is it would we expect that they could have memorized or should have memorized? What we'll also see as a typical characteristic of a recall item is that there really aren't very many variables discussed, if any, within these items, because these tend to be universal truths. The items tend to be fairly short. We can usually get to the point of recall item with just a single sentence. And so that too is an important characteristic to remember. In this case, I'm showing an example of a recall item in which what we're trying to assess is implement non-invasive ventilation for a patient with an exacerbation of COPD. And I'm going to use this content, that is non-invasive ventilation for a patient with an exacerbation of COPD, repeatedly. I'm first going to show you a recall item, and then later I'm going to show you an application item and then an analysis item, so hopefully to illustrate how you can take the same concept, same content, and you can, in a sense, spin it three different ways in order to create three different levels of complexity. This is a recall item. That's reinforced by the fact that we start the sentence with the word what. That means that the answer is going to be definitive. We're asking, what is the primary desired effect of non-invasive ventilation for a patient with a COPD exacerbation? We've marked CO2 elimination as the key. We have O2 delivery as a distractor, then bronchodilation and vasoconstriction. Here's an example also, particularly looking at option B, where I talked about the fact that a distractor doesn't necessarily have to be absolutely incorrect. You could argue that one of the reasons that you provide non-invasive ventilation is to help deliver more oxygen. But when the question is, the question was not, what is one of the benefits of non-invasive ventilation? What we're asking is more specific. What is the primary desired effect? And in that case, if you're given CO2 elimination as a counterpoint to O2 delivery, then we'd expect a more sophisticated, competent candidate to pick CO2 elimination over O2 delivery. There could also be fair debate about whether O2 delivery ought to be in the list. And this is, again, one of those reasons why it can be useful to expose your items to your peers, your other faculty, and ask for the reactions. If the reaction is, I don't think it's fair to have both CO2 elimination and O2 delivery in the same set or for this item, then you could just choose to remove O2 delivery and replace it with something else. But I'll suggest to you that this could be a viable, fair item to ask. A couple other things to point out is we have two options here that both have chemical symbols within them, two that do not, so we've kind of created two pairs of options, as I've illustrated before, and we have about the same length in each of these options. Moving forward, Okay, moving forward, we have another example of what's supposed to be a recall item. This time the task is review lateral neck radiographs for evidence of epiglottitis or foreign bodies. So here we have our stem. It's an incomplete sentence format, in which we're directing the test taker to find or for a distinctive finding associated with epiglottitis that can be observed on a lateral neck radiograph. And our key is marked here as airway narrowing. You wouldn't be able to see tracheal deviation from a lateral view. Vascular hypertrophy, you really would be able to observe that again on the lateral, and sort of tough to see edema in the tonsils or the soft tissues from any kind of radiograph. Something else I'll point out about the options is each of them contains 2 words. So here again, if a test taker is going to guess, they're going to look at these and say, boy, they all look pretty similar. And so I don't really have any clue as to what I'm going to guess. Moving forward to application items and talking about some of the characteristics of application items. First, if we want to cause candidates to interpret what they see, to take what they see and put things into categories or classifications. If we want them to translate or recognize that there are relationships between one thing and another, then these are classic kinds of application item activities. Anytime you ask a test taker to run a formula, that's at least at the application level. If all you ask them to do is run the formula and find the answer, that's still at the application level. If you ask them to run the formula, find the answer, and then react to it, solve a problem based on what the result is, now we've moved up to analysis. Same way with anytime you ask somebody to interpret a graphic or a data table, that's going to be at least at the application level. If the point of the item is limited to just what the interpretation is, or just what the conclusion is, or just what the diagnosis is, that stays at the application level. If you use a graphic data table, you ask somebody to reach an interpretation, but then go forward and solve a problem, now we've kicked up to the analysis level. So I've begun to illustrate to you how it is that analysis is different than application. And there, of course, will be many variables in these options. Some common characteristics of application items are listed here. These are going to be moderate in length as compared to the recall items. It's going to take at least a couple, maybe a few sentences to get the information in front of people. Now we are interested in putting variables in front of the test takers. Here we are back at the task about implementing non-invasive ventilation for a patient with an exacerbation of COPD. This time, this is intended to be an application level item instead of recall. So which of the following most strongly affects? Now right there is our first, we have a couple clues that there's more than just recall going on. We're saying which of the following. So that means there could be other things that potentially could be the right answer, but here's just a list of 4. So which of the following most strongly? The word most is indicating that you need to make a comparison as a test taker. So again, that's a higher level of mental processing. So most strongly affects CO2 elimination when a patient with an exacerbation of COPD receives non-invasive ventilation. And so then the test taker must consider these things and ask, well, does exhalation valve design affect CO2 elimination? Will the length of the circuit affect it? What about the humidification level? Or what about the degree to which the mask fits? And presumably then the better it fits, the less there's a leak. The less of the leak, the more gas goes where it belongs. And so that's why D is justified as the key here. Again, looking at the options, we either have 2 words or 3 words in each of the options. They all appear similar in length. In this case, the key happens to be the shortest, and that's okay, even though it is shorter than particularly A. But in the larger context, these are all of similar length. Here's another application level item. Here the task is to assess the effect of Peep, of a Peep change on pulmonary compliance. And so we have the story where Peep has been changed while the patient's receiving mechanical ventilation. The graphic below shows the effect of the 2 Peep levels. And so we can see that a Peep of 4 was tried, that produced the black graphic, and a Peep of 8 was tried, that produced the gray graphic. and that graphic is showing the relationship between volume and pressure. And then here's an important tip-off as to why this is an application level. The respiratory therapist should conclude. It's not asking what the respiratory therapist should do, what you should change, recommend. There's no action here. It's just what should the therapist conclude that the PEEP of 8 is associated with. So we go back up, and we can see that the PEEP of 8 was associated with a somewhat higher volume and a little bit lower pressure, and therefore that starts talking about compliance if you're a competent candidate, and not only that, but increased compliance. Focusing on the options, here we're strongly going for the paired parallel sort of arrangement, in which we have 2 options about compliance, 2 about resistance, 2 increases, 2 decreases, and so we're really trying strongly to pair these things up so they look equally likely to a test taker. Moving to the analysis items, as I've already alluded, you're going to need to put more information in front of people. So that's one area where item writers often fall down, is they don't give enough information. In my book, you need to give a test taker at least 3 independent pieces of information to consider in order to justify analysis level as the category for an item or for that level of complexity. And so you're going to ask the test taker to synthesize those at least 3 pieces of information, and then first conclude what they mean, but that's not where it stops, because if concluding what that information means, that stops at the application level. Where the analysis comes in is in the problem-solving action that's going to come thereafter. So analysis items tend to be the greatest in length among the 3 types of items. That's not to say they always must be the longest. That's not to say you could never have an application item that is longer, that it takes up more space on screen than an analysis item. It's just that as a tendency, they tend to be longer. There have to be variables there for the test taker to consider, and typically also will culminate in the test taker taking some sort of action. So the options of an analysis item very often are describing action, and therefore options of analysis items very often have verbs in order to describe those actions. Here is our first example. We're again purposely returning to that content of implement non-invasive ventilation for a patient with an exacerbation of COPD. So again, I'm illustrating. You can focus on the same content, on the one hand get a recall item, on another hand get an application item, and then treating it somewhat differently, get an analysis item. Here we see a woman with an exacerbation of COPD. She has a chest radiograph after 12 hours of non-invasive ventilation. The radiograph shows or is remarkable for an elevation of the left hemidiaphragm and hyperlucency below the diaphragm. So a competent respiratory therapist should start thinking about air that's in the wrong place, air in the stomach. The air is being provided under positive pressure to a mass, so there's nothing to keep it from going into the stomach. So actually there should be no surprise that there's some air there in the stomach and observed. We then have an ABG, and we have pieces of information from the ABG. We're not getting a full ABG, just that it reveals that the base excess is -1, which really is okay, and the saturation is 93, which is also okay for someone with an exacerbation of COPD. So there's no indicator in that information that tells you that there's a safety issue here, or that respiratory failure is immediately imminent or anything like that. It's actually, the ventilation is actually going along just fine. The one issue that needs to be addressed is the air in the stomach, and so the competent test taker should be able to reach that conclusion and recognize that if the stomach's decompressed, then that's going to make things better. Looking at the rest of the options, notice that because the key is a sentence, starts with a verb, that each of the other distractors also start with verbs. We've created a little bit of a pair with the decrease-increase, but we're doing that with 2 different of the settings here. We also have 2 things where we're changing settings, tidal volume FiO2, and then 2 things that could be done, in a sense, to the patient. One is a chest tube, and the other is decompressing the stomach. So again, kind of creating pairs, but these are all intended to be similar in appearance. Here we're returning to that graphic, that volume pressure graphic in the Peep change that we talked about before, this time spinning an analysis item out of the content. We have an unconscious patient, they're in the emergency department, a companion comes along and says this person's has a history of depression and even repeated suicide attempts by drug overdose. Importantly, the type of drug isn't mentioned, and you won't find that anywhere in the rest of this stem. That's going to become important when we get down to C, because there's really no reason to think or to know that there's been a anti-seizure drug that, or an evidence of seizures here that have been induced by the drug overdose. We have the fact the patient's receiving volume-controlled, assist-controlled ventilation with 100% oxygen, and copious pink frothy secretions have entered into the expiratory limb of the circuit, suggestive of pulmonary edema. Again, a competent candidate would be able to interpret that information and reach that conclusion. Peep has changed. Again, just happened to change the numbers. I used 4 and 8 before. Now I'm using 5 and 10. And there's our graphic once again. Our SpO2 has remained at 99 at both of those Peep settings, is what that's saying. And then which of the following should a respiratory therapist recommend? So again, that stemmed option connector is sending us in the direction of an action. Whereas for the application item about this content, we were simply asked to reach a conclusion about what was going on. And so particularly the evidence of the pulmonary edema should lead one to conclude that if a diuretic was given and the intravascular blood volume was reduced, that there'd be less fluid crossing over into the lungs, and so that would be the best of these solutions. That there is no evidence, looking at A, that the patient's ventilation couldn't continue to be managed with volume control, that there's really no indication here that high-frequency ventilation, and notice that that's non-specific high-frequency ventilation. It's not saying high-frequency jet, oscillation. It's not saying turn the conventional ventilator up to a high rate. It's just saying high-frequency. So the fact that it's not very specific could also be used against it as a correct answer. And then we also then have our anti-seizure drug that we've already talked about in C, which is a wrong answer. Moving forward, I have one more slide again because I observed that writers oftentimes miss the distinction between analysis and application items. And the distinction really is if you stop short and merely ask a test taker to reach a conclusion or to interpret what they see, that's at the application level. If you ask them to act on what they see, solve a problem by acting on what they see, after reacting to several variables, now that's analysis. You could have some items that culminate in an action, but if you're reacting to only one thing, then that would be an application level item. So I don't want you to walk away with this with the concluding that every item that culminates in an action has to be an analysis item. That's not the case. You first have to give them several variables to think about first. So that there too is a subtle distinction between analysis and application. I offer up this table to help potentially, this is listing different kinds of mental processes that will be associated with these 3 different levels of cognition. It may help when constructing items. So final thoughts here is we really kind of walk a tightrope. We never want to be accused of tricking. In teacher testing, you don't want to be accused of tricking test takers into making wrong answers. That means that everything that you offer to a test taker in the options needs to be real things. You can't make up new fancy-sounding diseases using Latin terms that don't exist. You can't come up with drug names from made-up words that don't exist. Everything needs to be real that you present to test takers in the distractors. It's just as important for your competent test takers to be able to find right answers as it is to keep the incompetent test takers from making successful guesses. So again, there's a balancing act that you need to play. And then lastly, because I made the mistake myself when I used to teach, is you need to stay away from trying to make humorous points in the middle of your test, because this is just really out of place and won't be found funny and could be construed as inappropriate or even distracting. So this is the conclusion of the webinar, and I appreciate it if you've made it this far. Although I said the intent here was to help give you some tools to potentially improve teacher-made testing If you do have an interest in serving as an item writer for the NBRC and you've now participated in this webinar, you're better prepared to write than many. And so I'd encourage you to contact me. My email address is there. And in the body of the email, you can indicate that you participated in the webinar and feel like you're ready to start submitting items for the NBRC. That process can take time. There are typically just a couple of points throughout a year in which we'll go solicit items. So it may take several months for us to follow up. A test developer would get in contact you and ask you if you'd like to write, and so on, and then send you a contract. And the NBRC has paid for items that satisfy its criteria, and so you can make a little extra change by successfully submitting some items for the NBRC. So we look forward to your doing that. So once again, thank you for your time. Have a good day.